Good morning, dear friends. Yeah, I want to use this opportunity once again to bring an important information to you this morning. Like I've always done. Let me just remind you that I'm your friend and gynecologist, always available to bring you gynecological and obstetrics health tips that can assist you to achieve a reasonable, healthy living. Right? All right. So today we'll be talking about vaginal health. Yeah. Now, I want to bring one important information, just one, to your notice, and that information is vaginal douching. What does that mean? Vaginal douching simply means the use of water or any substance, fluid substance, to clean out the vagina. It is often done with the intention to ensure that the vagina is clean, usually following discharge of any sort, following menstruation, or immediately after having coitus, having sexual intercourse. That's oftentimes the period that women douche. Now, this practice per se, pouring water inside the vagina, putting some, go as far as putting things, either brush, sponge, inside the vagina, just to scrape it and remove all the debts within it in order to make it clean. That is their belief, right? Now, let me shock you. Vaginal douching, it's not healthy, right? For your vagina. Why I said it's not healthy for your vagina is because the vagina is made up of and is an enclosed environment, with organisms that live in an ecosystem where the activities of a group of organisms check the activities of the other group of organisms and ensure that there is balance in that environment. No, what that means is that once the activities of one of the organisms start becoming overriding to the activities of the other, that completely alters the vaginal milieu. And that is what brings about the problems associated with douching. Now, what do I mean by douching? You pour water, you pour soap or soapy fluid or soapy water and all that, and you brush the vagina out. Not just at the vulva, trying to clean out the vulva because you are wet and all that, but sticking out your finger. Some of them have long nails that can even cause bruises as they are trying to wash off. Some of them use brush, some of them use sponges, some of them put all sorts of things in addition to the fluid. The fluid may contain some chemicals that can alter the vaginal pH. The vaginal pH is, around 4.5. If it becomes alkalinic, organisms thrive. Organisms thrive. And those organisms that thrive are the anaerobes. Normally, they are residents of the vaginal environment. They stay there and ensure the activities, are within normal. But once the vaginal pH rises, their activity, they will go out of control. And once they go out of control, they can cause infection. Now, the upper part of the genital tract, from your cervix to the womb and upper part, all of them are sterile. That means there is no organism there causing any problem. But once these organisms in the vagina have been altered, once the environment have been altered, the activities will increase, they tend to multiply faster. That means that they can now move through the cervix and access the upper vagina, the upper genital tract, which is the endometrium, where the baby used to stay, or where the menstrual blood used to come out from. And then the tubes. Sometimes they can even get into the peritoneal space and the ovaries and cause all sorts of issues for you. So why am I bringing this? In order to prevent these issues from coming up, please, you are advised to stop douching. Stop sticking things into your vagina. Stop putting candles. Stop putting sponges. Stop putting sticks. Stop putting anything at all into the vagina. The vagina is the design in such a way that it can clean itself. Whatever that comes into it will naturally flow out. So, if you are concerned about your hygienic practice, clean out the vulva. Whatever that comes outside, you can clean it out. You can use pant liners, so that all these problems associated with douching, will be averted. Now, there is one clinical condition we call bacterial vaginosis. That is actually what results when the vaginal milieu is affected and the organisms there begin to thrive. It is very difficult to treat, but it's treatable. So, but it's better you avoid it than you get into it, because the cost of treating it might be expensive compared to when it's averted, right? Now, the implication of having bacterial vaginosis is that if you become pregnant and you are having bacterial vaginosis, you are setting up yourself for preterm labor and preterm delivery. You will give birth to babies that are not mature, and you wouldn't want to experience that. It comes with all forms of neonatal morbidities and mortalities. So let me just leave it here. My point is, if you want to clean up yourself because of hygienic reasons, limit it at the outer part of the vagina, on the vulva. Once the vulva is dry, you are okay. Whatever that comes out, you clean out. Don't stick anything into the vagina. The vagina is sacred. Thank you. Always remember to check out on Nabo John Paul on Facebook, Life Train Specialist Hospital Online, and Women Health Corner. We also have a YouTube channel called Women Health Corner. Catch you in the next one.